Welcome to Health 999. Today, we're talking about something every woman should be aware of. 10 subtle signs of ovarian cysts you should never ignore. Ovarian cysts are fluid-filled sacs that can form on or inside the ovaries. Most are harmless, but sometimes they can cause real problems. Let's go through the 10 signs together. 1. Pelvic pain. One of the most common and often overlooked signs of an ovarian cyst is pelvic pain. This pain typically occurs in the lower abdomen, just below the belly button and above the hips. It might feel like a dull ache or sometimes a sharp, stabbing sensation. Some women describe it as a heaviness, a pressure, or a tugging feeling on one side. Pelvic pain caused by ovarian cysts can come and go, or it might be constant. You might notice it more during your period, during ovulation, or even after physical activity like walking or exercise. In many cases, this pain is centered on one side of the body, depending on which ovary the cyst is on. For example, if the cyst is on the right ovary, you might feel discomfort on the right side of your pelvis. And if it's on the left, the pain may stay on that side. But in some cases, pain can spread to the back, or even down the legs. Unfortunately, because pelvic pain can also be caused by many other conditions, like menstruation, endometriosis, or digestive issues, it's easy to dismiss it. Many women assume it's just part of their normal cycle. But when the pain becomes persistent, unusual, or disrupts your daily life, it's time to pay attention. You should especially take notice if the pain is sudden and severe, because that could mean a cyst has ruptured or caused ovarian torsion, a twisting of the ovary, both of which are medical emergencies. Listening to your body is the first step. If you've been experiencing pelvic pain that doesn't feel normal, don't wait. Talk to your doctor. A simple ultrasound can often identify the presence of a cyst and help guide your next steps. Your health is worth it. 2. Bloating or swelling. Let's talk about one of the most commonly overlooked symptoms: bloating or abdominal swelling. Now, bloating happens to everyone from time to time, especially after a big meal, during your menstrual cycle, or due to gas and digestion issues. But when bloating becomes persistent, unusual, or painful, it could be a warning sign of something deeper, like an ovarian cyst. Ovarian cysts can grow in size over time. As they grow, they may take up space in your abdomen, putting pressure on your internal organs. This leads to a feeling of fullness, swelling, or tightness, even if you haven't eaten much. Some women describe it as feeling like they're a few months pregnant, even though they're not. The tricky part is that this kind of bloating can be easy to dismiss. You might think, maybe it's just something I ate, or it's just that time of the month. But if this sensation keeps coming back, or if your belly feels visibly larger without weight gain, it's time to listen to your body. In some cases, the swelling may also come with mild cramping, pressure, or discomfort in the lower abdomen. You may find that your clothes fit tighter around your waist, or that lying down feels uncomfortable. If this sounds familiar, keep track of how often it happens, how long it lasts, and whether it's paired with other symptoms, like pelvic pain, changes in your period, or frequent urination. Remember, not all bloating is harmless. It may be your body's quiet way of telling you something's not right. When in doubt, reach out to your doctor. A simple ultrasound can check for cysts and help bring peace of mind. 3. Pain during sex. Pain during sex, especially deep, internal pain, is one of the most overlooked symptoms of an ovarian cyst. Many women feel uncomfortable talking about it. But it's more common than you think, and it could be a sign that your body needs attention. Let's be clear, sex is not supposed to hurt. Mild discomfort occasionally, that might be normal. But if you're consistently feeling sharp, stabbing, or pressure-like pain during intercourse, something deeper could be going on. Ovarian cysts, especially larger ones or those located near the fallopian tubes, can cause tenderness or swelling in the pelvic region. When pressure is applied during intimacy, the cyst may be pushed or irritated, leading to pain. Sometimes, it's one-sided. Other times, it feels like a dull ache that lingers even after. This kind of pain may also come with feelings of emotional stress or fear, making intimacy harder and impacting relationships. And because many women are taught to push through the pain, the issue often goes unspoken and undiagnosed. It's important to remember, this pain is not in your head, and it's not something you should ignore. If you're experiencing pain during sex, especially if it's new, frequent, or getting worse. Please talk to your doctor. They may recommend an ultrasound or pelvic exam to check for cysts or other underlying causes. Being aware of your body and speaking up when something feels wrong is not just brave, it's wise. 4. Irregular periods. One of the most overlooked signs of ovarian cysts is irregular periods. While it's normal for your cycle to shift slightly from time to time, frequent or dramatic changes could signal something deeper. Ovarian cysts can interfere with your hormone levels, especially estrogen and progesterone, the two hormones that regulate your menstrual cycle. When these hormones are out of balance, your period may become unpredictable. You might notice longer or shorter cycles, heavier or lighter bleeding, spotting between periods, or even missed periods entirely. Sometimes, your period might seem like it's starting, only to stop again a day later. Other times, it may come with more cramping, fatigue, or mood swings than usual. These are all subtle signs your body is trying to adjust to the presence of a cyst. One common condition linked to irregular periods is polycystic ovary syndrome, PCOS, where the ovaries develop multiple small cysts. Women with PCOS often experience infrequent or absent periods, along with acne, weight gain, or increased facial hair due to hormonal imbalance. Even if you don't have PCOS, a single large cyst can still throw off your hormonal rhythm. That's why it's important to track your cycle. Pay attention to changes, even small ones. Remember, having 1 or 2 irregular periods isn't always a cause for concern. But if you notice a pattern, especially when combined with other symptoms on this list, talk to your doctor. A simple pelvic exam or ultrasound can give you peace of mind, or catch something early before it becomes serious. Your cycle is like a window into your reproductive health. Don't ignore it. Your body is always speaking. All you have to do is listen. 5. Frequent urination. Do you find yourself running to the bathroom more often than usual? Maybe you feel like you constantly need to go, even when your bladder doesn't seem full. This could be a sign of something more than just drinking too much water. Ovarian cysts, especially when they grow larger, can press against nearby organs, including your bladder. This pressure can reduce the bladder's capacity to hold urine, making you feel the urge to urinate more frequently. Even small amounts of fluid in your bladder may trigger that uncomfortable sensation, like you have to go, right now. It's easy to confuse this symptom with a common urinary tract infection or even an overactive bladder. But if it happens often, and especially if you're also feeling pressure or heaviness in your lower abdomen, it's important to consider that an ovarian cyst could be the cause. In some cases, frequent urination from a cyst may come with other subtle signs, like bloating, pelvic discomfort, or changes in your menstrual cycle. But sometimes, this might be the only noticeable symptom. Unfortunately, many women ignore it or assume it's a normal part of aging or hydration habits. But your body is speaking to you, and it deserves to be heard. If you're waking up at night to urinate, or if your daily routine is being disrupted by constant bathroom breaks, don't just chalk it up to caffeine or stress. Instead, consider seeing your healthcare provider. A simple pelvic ultrasound can help detect the presence of an ovarian cyst and rule out more serious conditions. The earlier you investigate unexplained symptoms, the better your chances of addressing any issues before they become more serious. 6. Difficulty emptying the bladder or bowels. Have you ever felt like you needed to go to the bathroom, but just couldn't? Like something was blocking you, or pressing from the inside? One of the lesser-known signs of ovarian cysts is difficulty emptying your bladder or bowels. This can feel like pressure in your lower abdomen, a straining sensation, or the feeling that you're never quite done. Why does this happen? As ovarian cysts grow, especially if they become large, they can start to press against nearby organs. The bladder and bowels are located very close to the ovaries. So when a cyst grows, it can create physical pressure, almost like a small balloon crowding the space. You might notice that you feel the urge to urinate often, but pass only a little each time. You struggle to have a complete bowel movement, or feel bloated after. You have cramps or discomfort in the lower belly that comes and goes. Sometimes, this pressure can be mistaken for a urinary tract infection or simple constipation. But if it's persistent, and especially if it comes with pelvic pain, bloating, or irregular periods, it may be time to look deeper. Remember, not all ovarian cysts are dangerous. Many go away on their own. But when they grow too large or press against other organs, they can interfere with normal bodily functions. That's why it's so important to listen to your body. Don't brush it off. If you're experiencing these symptoms often, talk to a healthcare provider. A simple ultrasound can help detect a cyst and guide the next steps. You know your body better than anyone. When something doesn't feel right, trust your instincts. 7. Pain in the lower back or thighs. Pain in your lower back or thighs may seem like a common issue, maybe from sitting too long, lifting something heavy, or just aging. But what many people don't realize is that ovarian cysts can also cause this kind of pain. Here's why. As a cyst grows, especially if it becomes large, it can put pressure on the surrounding tissues, muscles, and nerves. Your ovaries sit low in the abdomen, near nerves that extend into the lower back and legs. When a cyst presses against those nerves, it may create a dull, aching pain that radiates into your lower back or even down into your thighs. Some women describe it as a constant pressure. Others say it feels like a pulling or cramping sensation that gets worse before their period or during certain movements. What's tricky is that this kind of pain is easy to dismiss. You might think it's sciatica or just poor posture. That's why tracking your symptoms is so important. If the pain is one-sided, if it comes and goes with your cycle, or if it's paired with other symptoms like bloating or irregular periods, it's time to take it seriously. Remember, pain is your body's way of asking for help. Don't ignore persistent discomfort. Talk to your doctor, especially if the pain doesn't go away or if it disrupts your daily life. Early detection can prevent complications and help you feel better faster. Listen to your body. It knows more than you think. 8. Nausea or vomiting. One of the more alarming symptoms associated with ovarian cysts is nausea or vomiting, especially if it appears suddenly and without a clear cause. This can happen when a cyst ruptures or twists, which is known as ovarian torsion. Let me explain this further. When an ovarian cyst becomes large or begins to put pressure on surrounding structures, it may cause a disruption in the normal functioning of the ovary. In some cases, the cyst can become twisted on its stalk, cutting off blood flow to the ovary. This sudden event can result in severe pain, nausea, and vomiting. A ruptured cyst is another serious situation. When the cyst breaks open, it releases its contents into the abdomen, leading to irritation and inflammation. The body responds to this with symptoms like nausea, vomiting, and even dizziness. If you experience these symptoms along with sharp, sudden pain in your lower abdomen, it's important to seek medical attention immediately. Ovarian torsion and a ruptured cyst are considered medical emergencies because they can lead to complications, including the loss of the ovary or infection. Even though nausea and vomiting can happen due to many reasons, when they occur in combination with other symptoms like pelvic pain, bloating, or changes in your menstrual cycle, it's crucial not to ignore it. Your body might be trying to signal that something is wrong, and acting quickly can prevent further complications. In some cases, ovarian cysts can be treated with medication or monitored through regular checkups. However, if the cyst is causing these more serious symptoms, surgical intervention may be necessary to remove it and prevent long-term damage to your reproductive system. So, if you're feeling nauseous or vomiting and suspect something might be wrong, don't wait to consult your healthcare provider. It's always better to be cautious when it comes to your health. 9. Breast tenderness. Another common symptom of ovarian cysts that many women experience is breast tenderness. Now, you might be wondering, how is this related to ovarian cysts? Let me explain. Our ovaries play a significant role in regulating hormones in the body, especially estrogen and progesterone. These hormones can affect different parts of the body, including the breasts. When there's a cyst on the ovaries, it can cause hormonal imbalances that can lead to various symptoms, including sensitivity or pain in the breasts. This tenderness often feels like a fullness or swelling in the breasts, and can make everyday activities like wearing a bra or even just touching your chest uncomfortable. You may notice that your breasts are more sensitive to touch or swollen, especially in the days leading up to your period. For women who are already dealing with menstrual irregularities due to ovarian cysts, the hormonal fluctuations can become even more pronounced, making the breast tenderness even worse. It's not just a random discomfort. It's your body's way of signaling that something may be off balance. Now, it's important to remember that breast tenderness can happen for other reasons too, such as premenstrual syndrome, PMS, pregnancy, or changes in birth control. However, if you're experiencing consistent and unusual breast tenderness alongside other symptoms like pelvic pain, bloating, or irregular periods, it could be worth paying closer attention to. If your breast tenderness is severe or comes with other signs like nausea, vomiting, or sharp abdominal pain, it's a good idea to contact a healthcare provider. They can perform tests and imaging, such as an ultrasound, to rule out ovarian cysts or any other underlying issues. 10. Difficulty getting pregnant. For many women, the journey to motherhood can be challenging. One factor that might be affecting fertility, often unnoticed, is the presence of ovarian cysts. While most ovarian cysts don't interfere with fertility, some types, particularly polycystic ovary syndrome, PCOS, can lead to difficulty getting pregnant. PCOS is a hormonal condition that causes cysts to form in the ovaries. These cysts can disrupt your regular ovulation cycle, which is crucial for pregnancy. Without ovulation, there is no egg release, making conception nearly impossible. This is often why women with PCOS may have irregular periods or skipped cycles. Even if you don't have PCOS, other types of cysts can cause trouble. For example, endometriomas, which are cysts formed from endometriosis, can lead to scar tissue or adhesions that affect the ovaries and fallopian tubes. This can block the path for an egg to be fertilized. Additionally, large or persistent cysts, if left untreated, may alter the structure of the ovaries, affecting their ability to function normally. These changes can potentially lower the chances of pregnancy. It's important to note that while ovarian cysts can cause fertility issues, it doesn't mean pregnancy is impossible. Many women with ovarian cysts do go on to have healthy pregnancies, especially with treatment. If you're struggling with fertility and suspect you might have cysts, consulting a healthcare provider is essential. They can perform tests, such as ultrasounds, to check the health of your ovaries and recommend appropriate treatment options. Don't be discouraged. With the right care and medical support, your chances of becoming pregnant can still be very much alive. If you've noticed any of these symptoms, don't panic. But do listen to your body and talk to your doctor. Early detection can make a big difference. Thanks for watching Health 999. If you found this video helpful, please like, subscribe, and share it with someone who might need it. Take care and stay healthy.